Good morning. I'd like to welcome everybody to a presentation by John Patrick University. My name is Brad Graham, and I'm the Business Development and Strategy Manager at John Patrick University. And today we're excited to have Brent Murphy and Michael Dubanowitz to discuss our medical imaging and our functional integrative medicine programs. So with that, I will hand it over to Brent Murphy, and he will address our programs.
Thank you, Brad. Why would a Brookdale student or a grad or alumni or faculty member want to attend JPU? We're pretty excited about this opportunity to work with Brookdale, right? So you can transfer your AS degree to our bachelor's degree programs, okay? Continue, therefore, right? Continue on to get a master's degree. You're going to find that we're really well suited for the working professional, the working adult, right? And with online and hybrid learning opportunities. And in addition to, we recognize how great this partnership could be, right? We offer tuition discounts for Brookdale students, grads, alumni, if it's been a while since you've been back to school, faculty and staff to study at JPU. My name is Brent Murphy. I'm a medical physicist by training. I've spent about 31 years in radiation oncology, and over that course, for about 10, 20 years, I've been involved with teaching at colleges and in various arenas. And so my passion is in the radiological sciences, especially on the oncology side and also on the imaging side. We found it to be very important that there was many professionals in these different spaces, if you will, that maybe were just button pushers. They weren't fully engaged with the technology and everything that could be done. And that was one of the reasons why we started the university, and then to scale that knowledge accordingly across the country and across the globe. We're located in downtown South Bend. We were established in 2009. We're a small university. We have programmatic accreditation, state accreditation, national accreditation. We participate in something called SARA, right? SARA is state authorization reciprocity agreement, where 49 of the 50 states participate. California does not, so we went out, got separately licensed in California, so we can train and educate students from all over the country. Right, we have federal student aid. In my day, we called that federal financial aid. Student exchange visitor program allows international students to come. GI Bill for U.S. Department of Veteran Affairs, and VA loan. So we cater to all individuals coming in to seek these type of degrees. We're national accreditor. In our last major inspection and audit in 2017, we were recognized as one of the schools of excellence. And so we take those metrics very seriously. One of the metrics we're most proud of is our graduate employer satisfaction metric, which 100% of our graduate employers are satisfied with our graduates that they have hired. And so we're going to work you hard. We're going to make you very, very well skilled and current on the technologies. And so what's the difference? Why do we do things a little bit differently? Well, what's unique is we offer accelerated programs. You can complete your programs in 12 to 16 months, right? At the same time while you're working. We have a rolling enrollment also. That's what makes it a little bit unique. You can start pursuing your advanced degrees in January, in May, or in September. So we run 3 semesters a year, trimesters. We have flexible scheduling. The lectures are pre-recorded. You can watch them once, you can watch them 10 times, you can watch them at noon or midnight or 2 in the afternoon or on breaks. You can watch little bits and pieces, right? And that's really good when you're preparing for quizzes and tests and finals, right? I think one of our biggest distinctions is that over 90% of our faculty are clinical. They're in the industry, they're in the trenches, they're in the clinics right now, right? They're industry leaders. They don't have to live in South Bend, Indiana, right? And we have a very robust learning platform that we've been using since 2009. So to understand our delivery, right, and we'll talk about our programs here very shortly. Programs are 16 months. If you do transfer in some credits, right, some students can finish in 12 months. They're 4 trimesters, and that's where you get the 16 months from. Each trimester is 15 weeks, right? This is for the blended learning side, and this will be for the online. 13 weeks are online. 1 week boot camp, if you will. They used to be 6 10-hour days, truly a boot camp. Now it's a long weekend, 3 12-hour days, right? A Saturday, Sunday, and Monday per each semester, right? And a 1 week break. The boot camps usually are held on week 10 or 11, and they're scheduled 2 years in advance so that everybody can plan accordingly. Again, the lectures are pre-recorded. It's a rolling enrollment starting January, May, or September. We really wrap resources around each and every student to make sure that they can be successful. Our online programs are the same thing, with the exception there's just no on-site instruction, okay? So they would have a 15-week trimester, 14 weeks online with a 1 week break. For schools, if you will, 1 university, 1 mission, but we got 4 schools, okay? School of Physics and Radiological Sciences. That's the area that I'm mainly engaged with, but in addition to the School of Medical Imaging Sciences, right? School of Business and Informatics. Our school was initially named up until August of 2019, Radiological Technologies University, because we just focused on those top 2 disciplines, top 2 schools. Now we've moved into School of Business and Informatics as well. And one of our more exciting schools that's really taking off is our School of Integrative and Functional Medicine. And we'll talk about all these schools. So School of Physics and Radiological Sciences, right? Here, you can get a bachelor's in radiation therapy, right? Coming out with your AS in radiation sciences or radiography, right? You can also get a bachelor's in medical dosimetry. This up here has a bachelor's track as well. And then from that, either just continue in or take a couple of years off, but come back for a master's. So it's a nice succession plan. And we're also building out some certificate programs. The School of Medical Imaging Sciences, right? So if you are a Brookdale student or graduate and you have an AS in radiography or the rad sciences, if you will, and you want to move into and complete and get a bachelor's, but a specialization in MRI, CT, sonography up here in ultrasound, or nuclear medicine, right? Just think you can do that in 12 to 16 months while you still work. That's the prohibitive thing, and many times is that some programs don't allow you to work, right? So we've got to throw extra resources to wrap around you to make sure that you're going to be successful. Now, if you don't really want the degree, right, you can get college credit, right, and certificates that allow you to sit for the respective boards in PET, CT, and MRI, right? So I'm going to just talk real quickly about these disciplines because they're really emerging, right? If I talk about radiation therapy, where you could go in and be a bachelor, right, radiation therapist, the foundation of oncology and the radiation side is very basic, right? Radiation can kill cancer cells. Problem is it can kill normal tissues as well. So we got this very simple goal: hit the bad guys, miss the good guys. We use this fancy technology to do that, right? We got to make sure we know what we're aiming for, right? How to focus that radiation, right? And make sure the radiation at best can miss the normal tissue as much as possible. And how do we handle motions, right? Patients aren't static, they wiggle around. We got internal motion as we lay down. So that role of the radiation therapist, right, historically, in the past, it was an x-ray tech that came up to become a radiation therapist. And they might do CT, you might learn a little bit of CT, they weren't CT techs, and to treat the patient. And on the x-ray tech side of the house, they made really great. That was the feeding system for radiation therapists. In the future, you're going to be involved in imaging and treatment authorization, registration and fusion, taking an MRI and overlapping it with the CT and making sure it's right? All the imaging support to make sure that if you're bringing in PET scans as well, helping the dosimetrist contour. You say, what's a dosimetrist? We'll learn that here in a second, right? Still got to treat the patient. I mean, that's what radiation therapists do, right? And incorporate big data analytics and risk management and safety aspects. So these fields are all changing rapidly with the technologists. I applaud you all, those that have went through the radiography program at Brookdale. It's a great profession to be in, right? Because not only is it a great profession to serve and help patients, right? It's a great profession that allows you a springboard to go into radiation therapy, to go into medical dosimetry, to go into CT, MRI, ultrasound, and nuclear medicine. Just some great opportunities. So what the heck is a medical dosimetrist, right? Well, it's a treatment planner. Okay, they do the treatment plans, right? The big radiation machines will deliver to kill that cancer, right? So the treatment plan is done by a medical dosimetrist. It's kind of like a flight simulator. And we have different planning techniques that we can do, right? And they'll do planning reviews. So in the past, it was just like aim 2 different directions to treat this head and neck case. But now we do this fancy planning because this is where the cancer is at, where this darker red. Blue is low dose radiation. But notice that we can spare the spinal cord. We can chop away and spare the areas that are parotid. What does that mean? We're not going to paralyze the patient. We can take doses very high. And on the parotid side of the house, right, by sparing the parotids, we can make sure they still have the capacity to make saliva. See, one of the things with head and neck patients is that we historically blow out the parotid glands. They can't make saliva. They don't want to eat. They lose 25 pounds. That's not healthy. Okay. New imaging trends. I have found our oncology field to be more dependent on the new imaging technologies coming forward. That's right up your alley, right? Multimodality fusions, putting MRIs with PETs, MRIs with CTs, MRIs with MRIs, T1s and T2 overlaps, deformable registration, molecular imaging, right, using PET, advancement of the IGRT modality. That stands for image-guided radiation therapy. So we take all these imaging modalities and set our patients up so much better. But look here, right? Look at this checkerboard, right, that we're using to tier over an MRI image set with the CT. Each has different characteristics and advantages. And that's how we treat our patients. Here's a coronal slice of a CT. This is a coronal slice of a PET, but look what happens when we blend them together. We can see this is normal uptake in the brain. So I don't have brain cancer, don't have bladder cancer, but notice the metastasis that we are seeing right there, right? We see it in the mediastinum, right? And we see it down here in the lobe of the liver. So using this to help beat cancer, using this new imaging technologies. And then therapy itself has got new imaging technologies. Hey, let's take a LINAC, a small LINAC, and attach it onto a robotic arm, right? And so here's the LINAC. This can come in and deliver over 100 beams of treatment. And so why? We want to kill the bad guys, miss the good guys. That helps us do that. It's called CyberKnife. I'm going to pass, right, the baton to Dr. Michael, who is going to go over, right, our School of Business and Informatics.
No, thank you, Brent. And I agree. I think it's such a wonderful partnership that we are collaborating with Brookdale, and such a valid point for many of you with your associates transitioning to a baccalaureate programs. But let's just say you already have your bachelor's degree conferred, or you're looking for more of an administrative role in healthcare to really emphasize above your baccalaureate degree. Well, within our School of Business and Informatics, we have some very unique programs that we're going to show you on this next slide. We offer a Master of Science in Healthcare Administration, very unique to JPU. And how does JPU stay ahead of the learning curve? One of the things we are offering are 3 unique concentrations within the Healthcare Administration program: Executive, Oncology, and Radiology. In development right now, we are noticing data and big data and analytics is going to drive our decisions in healthcare for the future, not just from clinical application, but we also have to look at from revenue and business and cost share development as well. So within your MHA program, by utilizing the data, by utilizing the science, by utilizing the results, we are able to make data-driven decisions, which will not only help our patients in the future, but also the healthcare organization that you are running or leading within the future. For those of you looking for a degree completion program, the school also offers a Bachelor of Science in Radiological Sciences, which you can then bridge into, after the completion of that, into your Master's in Healthcare Administration as well. So let's dive into what are some of the unique concentrations for this. So going over again, the program itself as a whole, the Master of Science in Healthcare will help you understand financial, legal, marketing, all the traditional focuses that one would expect within a healthcare administration program. When we look at one of our first concentrations on this next slide, radiology. Of course, this is an emphasis of what Mr. Murphy has done throughout his 30-year career and bringing the expertise to your classroom. So within the radiology focus, you are going to be looking at operations, maintenance, and specific core sections and competencies in conventional radiology, CT, MRI, PET and nuclear medicine, interventional radiology, and ultrasound. So very exciting that you'll be able to learn all of these core competencies within your master's degree program, really making you not only a competent practitioner, but a very effective administrator to have those expanded conversations with your clinical staff. The next concentration is oncology focused. And in addition to the operations and management, we are going to look at specific disciplines within this track. And those are surgical oncology, medical oncology, and radiation oncology. Again, this would be a great bridge for those maybe with the bachelor's in radiological sciences that want to look at the administration and management of oncology and oncology case management. This would be a beautiful track for you. And our final concentration that we're looking at is the executive track. And this is where we're going to place emphasis in the leadership aspects and really getting involved in the healthcare climate. You are able to have further in-depth conversations, speak in more depth with the trends in healthcare, and really impact your business and clients for where future of health is headed in the next few years. So very, very exciting of what's coming out of the School of Business and Informatics. Our next school that we are going to look at, as myself, that I serve as the Dean for the School of Integrative and Functional Medicine, and as Mr. Murphy said, this is really transforming JPU, but also aligning us for the future of health and wellness, really where medicine is headed for the future in a collaborative approach. So within our university, we have a Master of Science in Integrative and Functional Medicine with 4 distinct concentrations. You can study cannabinoid medical sciences, which is absolutely fascinating, and we're going to dive a little bit more, especially for those living within the Jersey region and its ability to educate and consult and practice within state laws. Our second concentration in lifestyle medicine, third, nutrition, and our fourth in sports medicine. Now, let's just say you have a baccalaureate degree or you have your master's as well, and you are really interested in just learning a little bit about integrative and functional health, but don't want to do a full degree program. We also offer 4 distinct graduate certificates that can be done in integrative and functional nutrition, nutritional counseling, nutrigenomics, which is a growing field, and JPU, we are very excited to be on the forefront of that field, including some of the faculty that we've brought on to lead that program, and paying homage to Mr. Murphy and his mission, but also as you're seeing the oncology trend span across all of our schools in nutrition oncology. This is one of the first programs in the United States that we've brought to JPU. So we'll talk a little bit more about that. And for those of you who are finishing up your associate's degree from Brookdale and want to go on to a baccalaureate program, maybe in healthcare, we offer a Bachelor of Science in Integrative Health and Lifestyle Medicine. So let's take a look at some of the classes and subjects and material that you're going to learn within all of these programs that we have listed here, and how does it make you a better clinician. But first, I'd like to introduce to you who are your leaders within the program. We have made it our mission, as Mr. Murphy said, we bring leaders within industry to the classroom. And this is what we've done within the School of Integrative and Functional Medicine as well. So leading the lifestyle medicine track is Dr. Felicia Stoller, one of the original diplomates from the American College of Lifestyle Medicine. Leading our nutrition track is Dr. Jim Painter, a PhD registered dietitian, one of the leading dietitians focusing in mental health nutrition. We have a dual rock star, Dr. Bonnie Brock, leading our nutrition oncology program. Dr. Brock serves on the Academy of Nutrition and Dietetics for dietitians in integrative and functional medicine. The acronym, if you are seeing it in social media, is called DIFM. And Dr. Brock is both a licensed naturopath physician and registered dietitian. Really dynamic expertise, bringing the clinical lens to the oncology program. And leading our nutrigenomics program is Valentin Prisacaro, who has over 20 years of research of studying food science, nutrition, and also developing programs in Focus 23, which is a clinical platform, and understanding how genes affect our health. And going back to where we said, utilizing that information to make decisions for better care and treatment. Finally, some of our other leadership that we have within the school, serving in a dual capacity are 2 individuals with our Cannabinoid Medical Sciences program. We have Dr. Anthony Smith with a background in biomedical sciences, and Janice Bissix, one of the leading registered dietitians in the country, focusing on holistic cannabis. For those of you entering into our baccalaureate program, that's going to be led by Dr. Orville Bigelow, and myself serving as your dean for the school, helping lead our program into the future as well. So let's dive into some really fun topics, as Mr. Murphy has talked about, some of his programs, what can you learn with a integrative and functional medicine degree? So those within the master's program, all of the classes you see here, all of you will be taking the same core subjects. Again, foundation is very important in integrative and functional medicine to have that baseline in order to have full expanded conversation. So some of the unique classes and what is that JPU difference and why earn your master's in integrative and functional medicine from JPU? We are teaching you foundations in lifestyle medicine, in natural medicine. We are going to be looking at functional blood lab analysis, how to make executive decisions based upon the results of those blood labs, and how to have a further conversation with your patients and clients. Another unique differentiation with this program is nutrition for mental health. Here you're going to learn psychobiotic supplementation, which is an emerging field where we are looking at probiotics, prebiotics. How does this affect the mind-gut disconnect, which we hear this a lot on social media and in digital print, but really that's the HPA axis, and how is that affecting mental acuity and emotions, and how are we going to utilize food and nutritional supplement therapy to make the patient better? Absolutely fascinating within the program. So let's take a look at some of the concentrations and some of the unique classes that you will take within your program. If you're doing our classic nutritional track, you're going to take 4 classes that you see here listed at the lower left-hand side of your screen in eating disorders, nutrition assessment, and a really funky course that I love in gastronomy science. Now you're probably saying, what is gastronomy? Gastronomy is the basic science and study of food. My original foundation in vocational trade is a classically trained chef, and over the last 20 years, I branched into nutrition, health education, and sciences as well. So we take nutrition, food science, classic cooking, dietetics, and blend it into this absolutely fascinating course. So you're going to learn everything from chemical structures of oil to how many volts are bolting out of your microwave, and does that affect you in any way, or the chemical compositions of food. So really, really exciting courses that you can take within the nutrition program. Our next concentration that we are going to look at is cannabinoid medical sciences. This is a differentiator on earning your master's degree from JPU, concentrating in cannabinoid medical sciences. This is the future. We are all seeing patients come across our desks that are either utilizing medical marijuana cards or utilizing CBD supplements, but how do we understand, or how are we able to have an expanded conversation with our patients so they are understanding dosage, toxicity levels, contraindications with any prescribed medications that one could be taking, or are they really even taking anything that's labeled CBD within their product, or is it just vitamin E oil? A lot of the times that you'll see that on the labels, because again, what are the laws? What are the rules? How are the community and industry utilizing cannabinoid medicine within industry? So we are not only making you a competent practitioner, but also clinician, educator, and researcher with some of these unique classes that you'll take in analytical chemistry of cannabis, phytocannabinoid pharmacology, and cannabinoid sciences. Absolutely fascinating within this track. And this is part of the future of healthcare, that you could have a very confident conversation with your patients and clients. Our next concentration that we are going to look at is lifestyle medicine. JPU is one of less than a half a dozen universities within the world right now that has a program specifically dedicated to lifestyle medicine. Why did we do this? Lifestyle medicine provides the opportunity to look at the root causes of diseases. So if you have a patient that comes into your office and they say, well, I am tired, what's the first thing that we do? Normally, we write a prescription. Well, here, our curriculum is aligned with the American College of Lifestyle Medicine, leading the way of healthcare education in the country. So if you have a patient that says they're tired, wonderful. We have a specific class in sleep, health, and wellness. You are going to dive 15 weeks looking at all differentiators in sleep medicine and how does that affect certain health conditions. You'll also take courses in health coaching. How do you motivate your clients if they are hitting a plateau within their treatment period? That's what we are teaching you within this program. Absolutely beautiful. And our final concentration within the master's track is sports medicine. This is a very unique program, and why did we attach it to the master's in integrative and functional medicine? As we saw in some of the core courses, you were not only able to have further conversations in herbal medicine, in functional nutrition, in functional lab analyses, but you will be able to then provide further scope of treatment, consulting, and coaching within some of these courses in fitness and wellness, sports and exercise nutrition, and a specific class in sports medicine and athletic training. So let's just say a typical patient has to lose 15 to 20 pounds, but needs to stay within a 60 to 80 gram protein consumption. How do we treat that and not affect kidney output? This is what this program will teach you. So we're very excited and looking forward to having you within not just our School of Integrative and Functional Medicine program, but any of the programs that you see listed here at JPU. So as we look at our next slide, one of the main questions that students ask not only Mr. Murphy with earning their credentials in medical dosimetry, medical physics, where can they gain licensure? Within the School of Integrative and Functional Medicine, what certifications are available for me? Based upon your program, myself and your program directors, we will guide you on some of the board certifications as you see listed here that you may be eligible for. And this is the personalized approach that we take at JPU. So very, very exciting, everything from clinical nutritionist to a certified health coach to a certified sports nutritionist. We will make sure the track that you are on guides you appropriately to help you with your future career goals and needs. Finally, I'm going to pass it back to Mr. Murphy as we start to conclude our presentation here. And again, just reshaping the benefits of this partnership. So Mr. Murphy, if you'd like to take it away.
Thank you, Michael. And just as a reminder, we really are looking forward to this opportunity with Brookdale. So if you're a student right now and or a recent grad or alumni that you graduated a decade ago, right? Even for faculty and staff, right? We have tuition discounts, right? We cater and we've set up an environment that if you are a working professional, right? If you're a working adult, if you're a working student, that it really allows you the opportunity. It's not a barrier. It allows you the opportunity to take that next step, right, in your higher learning education. And we look forward to working with you. Again, some of the advantages that we have were accelerated programs, industry leaders in each of the disciplines, right? So they're going to bring things that have not made it to the academic books yet, right? Trendsetters, if you will. And that's real exciting, both on the radiation side, on the informatics side, on the business side, and on the integrative and functional medicine side. So here's our contact information. If you have any questions, please visit the website or call us. And we'll walk through some of your questions or some of your interest, and it comes down to the bottom line. We are here to set up an atmosphere, a culture that you can pursue your dream. And in most of our disciplines, if you've noticed, it really caters to a provider that's going to go out there and help patients, right? Especially in this strange world of COVID. It has just really disrupted medicine, right? And as we get back to normalcy, cancer didn't go away. All the anomalies and medical deficiencies and medical diseases that we deal with, they didn't go away. If anything, right, they have grown. They have increased in frequency. Why? Because people were scared to go to the doctors. People were scared to get out and do something about it, right? So we've got a shortage in every one of the disciplines that we've talked about that we went through, right? As things go back to normal, the demands are going to be there that we need the best providers. And we look forward to working with Brookdale to be part of that solution so that we can help the providers so they can help their patients. Have a great day, and we really appreciate your time. Thank you very much.
Thank you.